Skin cancer prevention. Risks, myths, and effective strategies. Skin cancer is the most prevalent form of cancer in the United States, diagnosed in approximately 9,500 new patients daily. While anyone can develop the disease, certain factors significantly increase individual risk. These include naturally light skin, a tendency to burn instead of tan, fair hair and eyes, a history of sunburns, and a family background of skin cancer. However, skin cancer affects people of all skin tones, and prevention remains crucial for everyone. This article outlines how to minimize your risk, dispels common myths, and offers practical guidance for protecting your skin. Understanding your risk factors. The Centers for Disease Control and Prevention, CDC, identifies key risk characteristics. People with lighter skin tones are inherently more vulnerable because they produce less melanin, the pigment that offers natural UV protection. But it's a dangerous misconception to assume darker skin is immune. Melanoma diagnoses are increasing among people of color, and outcomes are often worse due to later detection. Proven prevention methods. Effective prevention hinges on consistent habits. Seek shade. Reducing sun exposure, especially during peak hours, 10 a.m. to 4 p.m., is fundamental. Urban planning that incorporates shade structures can be a public health benefit. Protective clothing. Wide-brimmed hats, UV-blocking sunglasses, and tightly woven fabrics, or those with a UPF rating, are essential barriers. Daily sunscreen use. Apply broad-spectrum sunscreen with an SPF of 30 or higher to all exposed skin, even on cloudy days. Reapply every 2 hours or more frequently after swimming or sweating. Addressing specific concerns. Many struggle to find sunscreens that work for them. Chalky textures that leave white residue are common complaints, especially for people with darker skin tones. Brands like Black Girl Sunscreen have emerged to address this, formulating products that dry clear and incorporate moisturizing ingredients like avocado and jojoba oil. Avoid indoor tanning at all costs. Tanning beds emit harmful UV radiation, linked to a 58% increase in squamous cell carcinoma risk and a 24% increase in basal cell carcinoma. Even occasional use before age 20 raises melanoma risk by 47%. Debunking common myths. Misinformation about sun protection is widespread. Myth: sunscreen prevents vitamin D absorption. This is false. The body regulates vitamin D production. Excess UV exposure doesn't equate to greater absorption. Supplementation or fortified foods are safer alternatives. Myth: darker skin doesn't need protection. Skin cancer outcomes are worse in people of color due to later diagnosis, not lack of risk. Melanin offers some protection, but it's not foolproof. Myth: sunscreen is harmful. Extensive research shows no evidence of harm from sunscreen, except in rare cases of allergic reaction. Emerging research studies suggest that nicotinamide, a form of vitamin B3, may reduce skin cancer recurrence in those with a history of the disease. Discuss this option with your healthcare provider. The bottom line: skin cancer is preventable. Consistent sun protection, including shade, clothing, and sunscreen, is vital for all skin types. Avoid tanning beds, address myths with facts, and stay vigilant about skin changes. Proactive measures significantly reduce your risk and improve long-term health.